Hi, it's Paul Pharma again. Today I'm going to talk about preparation for regulatory inspection and one of the key areas of that. Of course, in 10 minutes I can't go through all the steps and the processes for regulatory inspection. So I'm going to focus on training. Now, you might think that nobody's going to pick up on training during an inspection. Maybe they won't. But say you're preparing for 6 months and you get all your SOPs up to date and you put all your records up to date, get everything in place so that you can demonstrate that you're in control, but you don't get the team up to date. You don't upskill those that are going to maintain the status. And then say, instead of coming in 6 months, they put it off for a year because pandemic maybe. So you've got all your records up to date, your SOPs are up to date now, but in 12 months' time, you're going to have to do it all again. So it's really important, not just to prepare for an inspection, but also to get your team up to date. Make sure your team understands what you're doing. Make sure they've got a clear understanding of why the procedures are written the way they are, and if they need to change them. It may not be the quality team, it could be the operations team, it could be the sales and marketing, it could be customer care. Everybody needs to understand why you're doing the job, why you're preparing for the inspection, why you're maintaining the SOPs up to date, why you're completing the records. Not just so that quality accepts what you need to do, it's to run the business. And that's one of the things I think people forget. And what's the SOP there for? It's not for the inspectors. It's to run the business. It's so that the people that join the business understand what's expected. Work instructions, records, policies. It's not for the quality department. It's not for the auditors. It's for you, the team. It's for the people running the business. So you design it to actually operate the way that the business is operating. You design the systems to achieve the business goals. You don't go out and buy an EQMS off the shelf just so that you can show you've got one. You buy one that's as close as possible to what you need already. And if you need to do customizations, minimize the customizations. And preferably, no interfaces to other software, or at least a minimum number of interfaces. If you can get one that does everything, and I'm not talking about the most expensive one, I'm not talking about the ones that have been on the market for so long that they're dominating the market, and they charge 5-10 times as much as another. I spoke to somebody today who's already decided, or was it yesterday? No, it was yesterday. They've already decided which EQMS that they're going to put into place. But they haven't looked at what needed for the business. Well, that really doesn't make sense to me. You might have had a good presentation from the supplier, but if it doesn't suit what the business needs, then you need to look again and find something that does suit the business needs. And it's the same for the SOPs. Standard operating procedures have to do what's needed for the business. So whenever you think about preparing for an inspection, think about the business, think about the auditors, think about the SOPs, think about the team. Make sure you train the team, because they're the ones that can update your SOPs for you. They're the ones that can do the review. So maybe you've got, I don't know, 500, 1,000 people, and you've got maybe the top 20 or 30 doing the SOPs. Or maybe you've got a team in quality that does it all for you. What's the point? They don't know your business. They don't know, maybe they do know the business, but they don't know how your team operates. And they don't know what could be improved. The only way you're going to get the improvements is by doing it. You've got to work on the job, understand the job, write the procedures appropriately, and then ensure you've got compliance still. Okay, so that's it for today. Talking about training. It's Paul Palmer. Thanks, bye.